They really have a strong strategic thinking in background and very strong political commitment on healthy cities and working very comprehensively on these areas. So if you want to have a good example of healthy cities network, so then visit City of Helsinki Healthy Cities. And how does then healthy cities link to physical activity promotion? Looking at the main theme of equity and the sub-themes, so physical activity is strongly linked to all of these themes. It is a target group based thing, so in physical activity we can also identify in our cities that yes, who are the most people need for physical activity. In Finnish scale, it is the middle-aged men, but for example in UK it's very much women and girls who are in the target group. Immigrant population, of course, we have either more scientific evidence on this that yes, who need more physical activity, or then we just as people who organize the services, we know that yes, these are our target groups. And what I think also is very good from the physical activity point of view, that the cities who have been or are members in the Healthy Cities Network, they have this what I call strategic thinking and strategic development of many of the things in the cities. So that is also very useful when you start to plan physical activity in your city, to have not only that, yeah, you organize an event or we organize a service or we do this and we do that, but you need to have more comprehensive strategic thinking, that you need political commitment, you need the services of course, but then you also need to support the facilities, you need to have the access, you need to communicate, so you have to have the whole package in order to ensure that it's effective. The work. And I have been, as part of this collaborating center, so I have had the possibility to be in the assessment group of the applications, because cities apply for this Healthy Cities Network every 5 years. And now the cities have been applying, and I have been in the assessment group and reading all the applications from the cities. And I can say that each and every city has physical activity on the agenda and within their priorities in healthy cities. So it is very much valued there, and it is seen that yes, of course, physical activity needs to be among our priorities. But then on the other hand, there is, because you saw the map, Europe is wide, so there is also a big variety how physical activity is understood. This is also something that you all are very aware of. Some cities describe this more this kind of event-based activity days, 10-mile runs or activity days for children. There are activities for sedentary people which are identified, but the strategic approach is not very visible. Maybe there is this northwest part of Europe which is more strong, the Scandinavian countries and UK. There is a stronger approach on this, but it's not European-wide, it's not so visible. Of course, there are good examples. And then what is very crucial question is that how physical activity supports this equity and tackling the inequalities. So that is something that really still needs to be worked with in the cities. Yes, and of course these different target groups are identified. But again, something which is very typical for healthy cities is that because this urban planning, city planning and these environmental questions have been so strong in the healthy cities development, it is also visible in the plans, so that these preconditions to organize the environment to be physical activity supported is visible in, in the healthy cities. I guess you have been already yesterday discussing these background materials from WHO and healthy cities. Unfortunately, I couldn't be here yesterday, but I think physical activity has not so long history in WHO policies and programs. There has been other priorities, and it's quite recently, looking at the history of WHO, quite recently been coming on the agenda. But I think now there are good policies, tools to be taken, and especially looking at from the local level. And also, of course, coming from Turku, so we have identified our things in the book, where we have been looking back at how the things have been developed in my city. There are European examples. I'm not going into details of that, but Mark Jones, who was supposed to be here, Liverpool is one of the cities which has very strongly developed this active city approach already for a long time, and having this strategic thinking. Within healthy cities, we have had this cooperation between the cities who have been developing this active living, physical activity promotion approach. So with around 10 cities to exchange the experiences. Many of the cities are UK cities. It's of course very easy for them to describe their activities in English language compared to us, who have to translate everything first. So that's maybe also why they are so visible. Sheffield is one of them. Glasgow as an example, but also of course from the Netherlands, Scandinavian countries, Italy. So there are examples throughout the Europe. But then, going back to the local level, so the question is that, and the question what we always have to keep in mind also, is that how do our citizens, how do the people living in Turku benefit from this healthy cities and active cities cooperation? And the politicians come and ask them, why do you have to travel to Liverpool to learn what they are doing there? So you always have to keep in mind that you bring something for your citizens. It's not always direct, of course. It can be increasing of learning, and then new kind of thinking, which then after 1 year or 2 years develops into services. These pictures illustrate what we have brought from this international cooperation to Turku. So from Belfast is this paintings on schoolyards. Not only paintings, there is the whole framework of how the children are involved, empowered to plan these things, and how the parents are involved. So the painting is the outcome of a bigger process. And also these children playing, so that is a model from Bergen in Norway, to develop the concept of children's wonderland, using the track and field sport hall on Sundays for the families to gather together, having lots and lots of equipment, and then you have the children in there, so you don't have to tell that you might go and jump on the mattress because they are already there. So having in mind that you really need these concrete things to take back home. Then I say some words from which are described in this book, so that Turku in Finland has been a forerunner in developing this health-enhancing physical activity, and some points how did Turku make the change. And the history is already back in 90s. So to identify that, yes, it is really the sedentary people, because from the historical point of view, the city of Turku and the sports department was supporting more the top level sports. So really turning the direction that we don't need to provide services for them. They can find them those themselves, so it's of course a sedentary people. And developing this, what I call this a strategic approach already in late 90s. And of course this cross-administrative networking between different departments of the city, sports associations, other collaborating partners was among the crucial things. And the fourth point was that we don't need those sedentary people in the sports places, swimming halls, sport halls, but they are meant in different settings, schools, working places, healthcare and social welfare contexts. Looking at them now, these are so self-evident, of course, but having the discussion within the city administration, in the sports department, in the political board of sports and recreation, having the discussion, it really doesn't happen just like that. Although everybody understands that yes, these are the elements that are needed, but taking the message forward, it just takes time. And also the other aspect is that then when you have decided and find the direction, so what do you need?